right, welcome everyone to this Batten Expert Chat. My name is Andy Pennock, and I'm a professor here at the Batten School. I'm delighted to welcome today three of our wonderful alums. We have Lauren Russell, class of 2016, class of 2017, who's with the Veteran Affairs Administration in the Chief Medical Office in New England. Welcome, Lauren. We're delighted to have you. Can you wave to sort of identify yourself? There we go. We have Mark White, who is the class of 2016. He sits in my former office, well, a nicer version because he has a window, but in my former division, the Fiscal Research Division in the North Carolina General Assembly, where he staffs the Justice and Public Safety team with an emphasis on the FEMA relationship, if I'm thinking of that correctly. So we're delighted to have Mark here to talk about how state government is interacting with COVID. Lauren's obviously going to bring us a federal perspective. And then last but certainly not least, the wonderful Maggie Anderson, who is class of 2018. She's the Deputy Chief of Staff to the Mayor of Richmond, Mayor Stoney. And for those of you from Virginia, you'll know all the things that have been happening in Richmond recently. And you know, I'm delighted that all three of you are willing to come. Everyone's been following what's been happening in New England, Lauren, and it's been a very challenging situation up there. Mark, you know, I think state budgets are at the front of everybody's mind, and so being in the budget shop and wondering with state revenues, what's happening there. And then Maggie, some of the direct decisions you're making on the front line about you and your bosses, about when to reopen Richmond. Are you a part of the phase-in process? Every municipality in the country is making these decisions, often in relationship to the local or to the state and to the federal governments. And so I'm really excited to have a conversation amongst the three of us. I know you guys quite well. You've all been my GTAs at various points, which I'm really grateful for the work you've done for Batten in the past and grateful you're here. I'm wondering if you could just introduce yourself briefly and explain a little bit about your roles for the audience. And let's start with Lauren.
Sure. So as Professor Pennock said, I work for the VA New England healthcare system. I work in the Chief Medical Office. I'm technically a health system specialist. That's a pretty vague term. So I do a lot of work related to clinical operations and making policies that impact the way our clinics run and the access to care that our patients receive. So that's where a lot of that healthcare policy comes into play, but on the more clinical versus administrative side.
Awesome. Mark?
Yeah, so I'm a fiscal analyst at the Fiscal Research Division at the North Carolina General Assembly. We are the nonpartisan staff agency, one of the nonpartisan staff agencies here at the General Assembly that focuses on the budget and other fiscal issues. We advise all members of the General Assembly, all 170 of them, so I have 170 bosses from both chambers, both parties, on budget matters, and we help facilitate the passage of the annual budget and any other spending bills that may come up. We also help facilitate oversight of the executive branch as they are executing the budget every year.
Awesome. Thanks, Mark. And Maggie.
Hi, everyone. Maggie Anderson. I serve as Mayor Stoney's Deputy Chief of Staff in Richmond, Virginia. So my role, I don't necessarily have a set policy portfolio that I'm looking at on a day-to-day basis, which is both has pros and cons. So I'm constantly getting a lot of fun projects from the mayor, including working on things from budget to economic development projects to being one of his advisors as we move through the COVID-19 pandemic. So my day-to-day changes a lot in terms of the policies that I'm looking at, but I also help a lot with the day-to-day administrative items within the mayor's office. So excited to be here with everyone.
All right. Well, the reason I reached out to the three of you guys, and actually Maggie really initiated this conversation, is thinking about how your jobs and positions particularly have been impacted by COVID. And you guys are in different front lines, but you're certainly on the front lines of policymaking. You're relatively young alums. I think, Mark, you said you've been out 4 years now at FRD, and you're making and helping decision makers make really crucial decisions across these various levels of government. Maggie, I wonder if you could just start with an example of something that's come across your desk or a decision that is currently on your desk that you're helping people make, and then we'll move back up the levels to Mark and then to Lauren.
So I think what immediately comes to mind is the decision that Mayor Stoney had to make last week as it relates to whether or not the city of Richmond would enter into phase 1 of Governor Northam's reopening plan for Virginia. And what the challenge behind that was that localities at the time did not have access to all of the data that the governor was looking at to make that decision to reopen. Specifically talking about the case percent positivity ratio that they're using to show a 7-day kind of moving average of where positive cases are in Virginia. And so we requested that data from the governor last week, and we finally got it last Thursday, being able to make that decision, showing that the city of Richmond's positivity ratio is actually increasing versus flattening or decreasing like a majority of other localities across the state. And so Richmond, along with Nova, kind of as a general region, and Northern Virginia, we made the decision to not enter into phase 1. And that was a really challenging decision to make, because, I mean, we were balancing the health and safety of residents along with the needs of small businesses in Richmond. And so that was really a challenge, and we're working, over the next 2 weeks, because we got a 2-week delay, to really think about how we can reopen the city safely, working with small businesses to support them and the needs that they have, but also, making sure that we can increase testing availability and capacity in the city, access to face coverings for the public who might not have them already, and being able to connect our under and uninsured folks with a primary care provider. So there are a number of things that we're looking at over the next 2 weeks as we look at reopening, but that was definitely one of the biggest challenges that we've had to look at recently as it relates to the pandemic.
Thanks for doing that work. That's those are big decisions to be made. Mark, how about you? What's a COVID policy issue that's come across your desk that would be interesting for folks to hear about?
So I think that the biggest thing really is the overall sort of state of play for the state right now. It's changed a lot of things, and a lot of the decisions and actual, sort of on the ground work is being done with the executive branch, which is obviously their job. But the legislature has had a lot to wrestle with and some decisions to make. Congress passed the CARES Act, which was, I think, their third of the major stimulus bills that they passed for COVID-19. And as a result of that bill, close to $4 billion was for COVID relief was sent to North Carolina, of which $3.6 billion was sort of, some of that money was going directly to certain localities if they were at or above a certain population threshold. But about $3.6 billion of it was sort of in the hands of the General Assembly to appropriate and determine how that money ought to be spent. So at this point, a couple weeks ago, the General Assembly came back into session and passed a COVID-19 relief bill. 2 separate bills, actually. One was a policy bill and one was a money bill, so to speak. The fiscal bill had about $1.6 billion of that $3.6 billion that it appropriated for a host of different purposes. Millions of dollars for COVID research, supplies and training, support for local government costs and other miscellaneous expenses for state agencies, like overtime costs at the prisons and other facilities, funding for schools, higher education, social services. It really ran the gamut and touched pretty much every facet of state government. That leaves about $2 billion left in the package that the General Assembly has not yet appropriated. And the question is what to do with that funding. The rules for the CARES Act money say that the money has to be used for COVID-19 related purposes and can't be used to replace lost state revenue. And the challenge that we have at the state level is that we have to balance our budget, And so with that $2 billion remaining, the question is Congress going to potentially change those rules and allow states to use it for revenue purposes or for other purposes, maybe broaden the rules a little bit? We're really not sure yet. And it's kind of a wait and see situation. Meanwhile, the other big issue is just with the economy taking such a big hit from everything related to the coronavirus, and with the tax filing deadline being pushed back to July 15th for both state and the feds, that presents us in the budget office with a number of challenges, namely that we don't know how much revenue is actually going to be coming in until after the new fiscal year is supposed to start on July 1. And so we, again, are sort of in a bit of a holding pattern in terms of what that's going to look like. It's very possible that there could be some very, very big hits in terms of revenue taking a major dip. There have been some estimates that suggest it might be as high as $4 billion. There are some that are lower than that, but either way, we may have some very difficult decisions ahead.
And put that $4 billion in context. How big is the budget in North Carolina?
The amount appropriated by the General Assembly is around $24 billion. So depending on the estimates that you hear quoted, there are lots of different folks out there. There's nothing official, but 10%, 12%, 15% could be lower, but those are some of the numbers we're talking about.
And how does your shop begin to think about, are you worst case scenario planning for those? Are you actively trying to think about cuts that would need to be made in order to balance the budget? Or how's that process working?
So I think that the most of what we have, I'll say this, in general, fiscal research, prepares for the upcoming session and looks at revenue projections and looks at, the needs that the state has in terms of expansion and really what the members want to do, because ultimately it's up to them. And so I think that, certainly we're aware of the situation in terms of what the revenue picture is looking like. But I don't know that there's anything, specific in terms of beyond our general work of keeping track of, how spending is going, listening to agencies and looking into member concerns at this point.
Thanks, Mark. Lauren, what's a challenge that you've faced at the VA? I know you had for those that are on the call that aren't that familiar with the Batten curriculum, we do a thing called the 48-hour project, which is a famous project at Batten where you're given a policy problem. All professors cancel classes and you have 48 hours to produce a real world policy brief and a presentation about it. And Lauren, when you and I were emailing, you said, I feel like I've been doing a 48-hour project every 48 hours for the last 2 months. And I see Maggie nodding with that as well. I know ventilators have been on everybody's mind. I know that was one of your projects. Would you be willing and able to talk about that one with us?
Sure. So yeah, I did say it seemed exactly like the 48-hour project. There have been several of those tasks that have come onto my plate and that I've needed to turn around pretty quickly, primarily both because of working for the federal government, but also given that it's a healthcare system, we need to respond pretty rapidly, given that we're treating patients who have COVID-19 and or patients who are suspected for having COVID-19. So as you can imagine, lots of challenges with personal protective equipment, making sure we have enough beds, making sure we have providers. So those have all been challenges. But one of the biggest ones that I was tasked with working on, which is the one that I compared to the 48-hour project first, was working on building an algorithm for allocating scarce resources. So primarily the scarce resource we were most concerned about were ventilators, and a lot of that was because I'm based up in the Boston area. Massachusetts was hit pretty hard. We just started phase 1 reopening 2 days ago, but there's still a large amount of cases in this area. Boston itself is still not open yet and won't open at least until June 1st. So that was what I was working on. I didn't know anything about allocating ventilators. I didn't really know anything about the ethical guidelines that kind of shape how you decide who should get a ventilator and who shouldn't get a ventilator. I must say it was a little bit distressing to try and figure out how to decide who would get those. And really, we wanted to create a framework that would make it most clear so that the clinicians making those decisions could follow these guidelines and both be protected from a legal standpoint, as well as to try and remove that responsibility from their plate due to concerns about physicians in moral distress, which is something that was really impacting a lot of the clinicians in Italy who we were having conversations with when they were forced on the front line to make decisions about whether or not patient A or patient B was going to get the one ventilator that was left in the hospital. Other complications that come with ventilators too, just for those of you who are not working in healthcare systems and that I learned through the research, has to do with how long you leave patients on ventilators, and also when and if you decide to remove a ventilator from a patient. The complexities that come with that of both, once again, going back to that moral distress, but also having those complicated conversations with families, particularly when families aren't actually able to be in the room with the clinical providers or their loved one who may be removed from a ventilator. So I was asked to do this. It was on a Wednesday, and I was asked to have a full algorithm and framework developed by Friday so that we could start reviewing it with clinical providers and make sure, both that we were taking into account what we knew at that point about COVID-19 and clinical concerns. So that relates to taking into account the comorbidities as well, like diabetes, cardiovascular disease, things that may make individuals experience a more severe form of the infection. And then also making sure that we were accounting for ethical guidelines and how we could make these decisions most fair to the patients who could potentially be experiencing them. So I think that was one of the most challenging things I've been tasked with. That, of course, went through many iterations. The first 48 hours were just rough draft number one. I probably wouldn't have been able to write 20 pages in 48 hours had I not gone through a lot of the work at Batten. That really prepared me, and I felt like that's what happened again because my boss did tell me to pretty much cancel all other projects I was working on and do nothing else except focus on that. So I had, 200 pieces of paper probably printed and all over my apartment of reading through other guidelines and seeing what recommendations were from both bioethicists as well as clinical providers who had thought about these concerns previously based on MERS and SARS and other concerns that we were likely to experience a pandemic similar to the 1918 flu. So the great thing was a lot of resources exist. The downside is this is complicated because going back to that point I made at the beginning about being at a federal level, we also need to take into account what works across state lines. Since working at a regional office, we need to make sure this is going to work for all the states in New England. So it'll work for Connecticut, Massachusetts, New Hampshire, Vermont, Rhode Island, and Maine, as well as making sure we're not going against any guidance that's been issued by the White House or other federal agencies. So it takes into account a lot of those factors, and it was challenging since neither Health and Human Services nor the White House had come up with clear-cut guidance about how to issue scarce resources. So that was probably one of the challenges too, was reviewing all of their materials as well and making sure that we were in line with both, reasonable ethical standards, but also what the federal government was suggesting we do should we experience an issue where we had a greater demand than we did supply.
So Lauren, we have a question from an anonymous attendee asking, how do you focus? I mean, that's an enormous amount of moral weight on your shoulders, an enormous amount of information scattered around your apartment. I like that visual of all those pieces of paper. How did you spend those 48 hours?
Yeah, so that was pretty hard, honestly. Initially, when I started, I was both stressed about honestly experiencing my own personal moral distress of having to figure out how I was going to come up with guidelines like this. This is, once again, nowhere in my wheelhouse. I took one public health ethics class when I was an undergrad at UVA, and that was a good exposure, but didn't really equip me for this type of scenario necessarily. So in terms of starting out, first, I just truly Googled allocating ventilators and started reading through some articles that had been in the news. Once again, this was back in March, so this is when there were a lot of concerns that states like Massachusetts or New York or New Jersey might experience this scenario. Unfortunately, those news articles, of course, did not give me guidance of what to do, but they were helpful in terms of referring to other resources and guidelines that had been developed between kind of 2005 and 2010, when a lot of clinicians were and public health professionals were expecting that we would encounter some other pandemic. So started with that just to get a good feel for what resources I should reference, which ones had a lot of work go into them, who were the experts and who should I refer to. So starting to get a good handle on that. And then I did a lot of comparisons across different frameworks and guidelines in terms of looking at what the kind of standard ethical principles were, trying to find similarities throughout them, as well as then looking at similarities about what different clinical and journal articles were saying about common comorbidities associated with severe infections and common diagnostic tests you should look at when trying to figure out how to allocate ventilators. So it became really trying to hone in on the ethical principles and also the clinical factors. And that's where I started to focus when I had those 200 pages printed out. That was probably somewhere around 10 to 15 guidelines from other healthcare systems and states. And I just started really focusing on particular areas. So that's kind of how I narrowed down the scope. But that probably took about a day at least of those 48 hours to just figure out where to narrow the scope, because I needed better background about where I should even start and what areas were most important to focus on.
I think one of the things that's so helpful to me about the 48-hour project and much of what we do at Batten is teaching you how much you need to know before you can start making decisions. Like, when do you know that you know enough that you, because it's an infinite amount of information out there in the world. When do you know enough that you can then begin to start doing things? Mark, I see you nodding your head. Would you like to speak to that?
Yeah, sure. And I think that's really, it's not only knowing when you know enough in the sense of, do I have enough expertise to do this thing? That's enough. Let's cut it off. We got to make some decisions here. There's a saying that, good analysis delivered on time is better than perfect analysis delivered late. And that is something that you sometimes run into working in public policy. You rarely have the time that you want, as Lauren illustrates, to be able to fully research everything you might want to.
Yeah, it seems like all three of you have generalist jobs. I mean, I think Lauren might think of her, we might commonly think of Lauren as having the most specialized because she's in the VA, she's in a policy office, but all of you, have so many different issues from so many different angles coming across your desk. Maggie, I wonder if we could come back to you, and you've already begun previewing for us this phase one and some of the decisions the mayor is making about reopening. At the university, it felt like for the first month and a half, we were just running around trying to put out fires. And we were trying to just solve problems as they were coming up. A lot of it was technological, some of it was pedagogical, some of it was safety related. Now for the university, we're beginning to think about the medium term and all the conversations about the late summer and the fall. I wondered if you could talk a little bit about how you see your organization's, what challenges your organization is going to face in the medium to long run. And I mean that both in terms of, the COVID responses, but also for the organization itself. Can you all go 110% indefinitely? Are there ways that you guys need to learn, your organization needs to learn in new ways, or have process be different with the state, et cetera? So if you could just talk a little bit about the medium term challenges that you see coming.
Yeah, so I've kind of been viewing kind of in two different phases, really, kind of the short and the long term. And in the short term, we've really been, I feel like, managers. You have to manage and immediately respond to needs. And I see us now, as we're thinking about how we reopen, we're shifting a little bit more to the leadership role, to long-term thinking and planning. And so I think when I think about how the city of Richmond government has to change, I mean, we've done a lot to respond to the pandemic in terms of providing supports to folks, or, making sure that utilities are not cut off during the pandemic, things like that. And even though City Hall might be closed right now, we've still been providing our essential city services and things like that. And we've had to be innovative. And I think that when you're thinking about the medium term and reopening a little bit, I think some of our customer service lines and things like that are going to come back online that have been a little bit more offline right now. But we're really thinking through how can we let some of the bureaucracy fall to a certain extent so that we can make things easier for folks to access when we're doing a lot of things virtually, or not every office in City Hall will be physically open. And so some examples of kind of local government innovations, we've shifted to providing building inspections virtually, which has been a really big shift for the city of Richmond because we've had some historic problems with our permit office and making that wait time not as long. And so this has really allowed greater access and speed to building inspections. So that's been like something that we think is working really well, and we're planning to continue in the long term. So things like that are offering virtual workforce development workshops, making those more accessible to folks. I think those are different things that will continue. I think kind of speaking a little bit to what Mark was talking about as well, we had to cut $40 million from our budget, which is quite a bit for the city of Richmond. And this year we were really excited about our fiscal year 2021 budget because as silly as it sounds to be excited about a budget, but we had a lot of new programs in there that were going to be addressing inequities in the city. And as you all know, that this pandemic has shed light on those systemic inequities that have continued to persist. And so I think we're going to have to be innovative. The way that the mayor's talked about this pandemic and how Richmond's responded as a giant team project. We've been collaborating in new ways across private sector, with the public sector, across with philanthropy and nonprofits, and health providers. So I think in the long term, the medium term, we're really going to be building on those relationships across different sectors to provide services and be able to lift Richmond back up in the long term. We're viewing this as a transformation to ensure that we bring Richmond back to a more just society than we left it. So really working on that, not just a reopening, but almost like a rebuilding, a transformation for the city, so that we can address some of these inequities, even if we've had to cut a lot of funding.
It's a beautiful vision. I hope it comes true. Mark, did you want to talk a little bit about the kind of medium to long run challenges you see both for the state and for your organization, the legislative budget office specifically?
Yeah, sure. And I also think just, you made me think in terms of the kind of personal side of it, even beyond just the policy end of things, but the logistical shift that the General Assembly has had to undergo. If you think about the legislative process, it's very collaborative. It's essentially a 170 person committee, and it's very difficult to shift those kind of meetings, which very often involve confidential conversations or candid conversations into, or just, getting folks in the same room so you can actually hash something out. Having to shift to doing that virtually, I think has been a challenge that the General Assembly has had to deal with. It's been kind of fits and starts. And I think that obviously some members have maybe adjusted to it more quickly than others have. There was also a legal question for a little while that I believe that the lawyers have figured out that had to do with public meetings laws. And, could you actually have a legal public meeting in a, Zoom or WebEx, whatever your preferred software is? Could you legally have those kind of meetings or not virtually? And what rules do you have to set up to make sure that there's public comment and that there's public access to those meetings? I think that as this progresses, the extent to which those changes are permanent, or that we have to fall back on those systems if there's a second wave of infections or the various scenarios that folks are talking about nationwide, I think that's going to be an interesting thing just operationally for the General Assembly to wrestle with.
And it really brings to mind to me the equity concerns for rural broadband. Right, for those of you that don't know, North Carolina is a very long state from Murphy to Manteo, and it's got a lot of rural areas, and just like Virginia does. And when we talk about this new post-COVID, COVID/post-COVID world, will we begin to think about internet more like a public utility where we force companies to build out like they did electricity to the rural parts of America? Rural electrification really changed the country. And will we see something similar with rural broadband? And we see the legislators doing that now in terms of access. So that's really interesting. Lauren, I'm going to cut us a little short because we want to get to the audience Q&A. Feel free to pick up if you want to talk more about the VA's challenges in a second. But I wanted to ask you, we've got several current students on the call and I think a few future students as well. When you guys reflect back on your Batten education, what are some things that you saw that you're relying on, that you're pulling from, where you're seeing themes that were developed, skills that were developed when you were a student? Lauren, would you like to start?
Sure. So one was going back to the 48-hour project, as I mentioned. Primarily just as a Batten student, I felt like we were given a lot of assignments where we needed to do a lot of research and be able to write pretty quickly and also concisely. I definitely came into Batten coming back with my public health background and being used to kind of writing these rather lengthier papers or articles. And one of the skills I learned in Batten was definitely how to write more clearly and more concisely, which was an excellent skill to learn then and has proved to be very useful now. So even though I mentioned that scarce resource allocation document was 20 pages long, I tried really hard to make certain sections concise and try and be as clear as possible, knowing that people reading it wouldn't necessarily have all the background that I had when crafting it. And the other thing I found really helpful was after being a teaching assistant, especially since I was a teaching assistant for a postgraduate course, and I was straight out of undergrad when I did that. I was 22 and most of the students were older than I was when I was teaching that class. Yes, Maggie was one of those students, and I often felt pretty intimidated and not incredibly confident standing up in front of the class teaching the discussion section. Primarily because I felt like they were questioning whether or not I should be teaching them when I was younger than them, and also right out of undergrad without much work experience aside for my internship between my first and second year in Batten. So I think one of the things I found most useful about being a teaching assistant is that it gave me a lot more confidence to be able to talk about information that I know about and that I've done research in, and be able to talk to audiences who maybe have a lot more experience than I do. So as part of that scarce resource allocation document, I had to present it to researchers and physicians who are both many decades older than I am and also much more experienced than I am. But because of being a teaching assistant and practicing my public speaking skills and working with students who are older than me, I felt much more equipped to be able to present to those audiences and feel confident and competent doing so. And even being open to taking their feedback and being able to kind of defend why maybe I chose to do X or Y or Z. So I thought that was really useful.
Maggie?
I know, I definitely agree with Lauren. I think being a teaching assistant is so helpful now because you just really had to jump in a lot of the times and get things done. And so I continue to take that mindset with my job, because a lot of the times it is just jumping in and saying, okay, yeah, I'll do that, and move on. But when I was thinking about how Batten has really helped prepare me for my current position, I really think it's I don't know if I can necessarily point to one specific thing, but it's a Batten set of mind, if I could put it that way, where you're how you think about identifying the problem that you're trying to solve, how you think through the various options for solving that problem, how you weigh the options, and then how you communicate your final decision. And I think Batten helped really create that mindset, that way of thinking. And then pulling a lot on the leadership classes as well for how you communicate that and how you implement it has definitely been really helpful, because a lot of the times, Richmond is a very active community, And there are a lot of different, folks with a lot of different points of view here. And so I think it takes being able to clearly articulate why you have chosen a specific direction for the city. And I think Batten really helped me be able to help advise the mayor on that.
Awesome. Mark?
So just briefly, I think I mentioned it earlier, but I really think that the collaborative learning environment, the emphasis on working in groups and teams, that's a core part of the Batten curriculum, is really, it's something that I am in every day. As Professor Pennock mentioned, I'm on the Justice and Public Safety team. There are 3 of us at this point that are working on JPS issues. We have several other teams internal at Fiscal. And that's been one of the challenges is, how do we keep meeting as teams in a distance environment? But it's a very, very collaborative environment, and Batten really emphasizes that, and I think that's been a great benefit.
Awesome. All right, so that was the questions that I had for you guys. We have some audience questions beginning to roll in, and some fun names that are popping up on the chat. Hi, Allie, Laura. Let's start with the Dean's question. I'm not sure if he's still in the call, but you can see it at the top. I'll read it for those that can't. The question is there something you wish you had known back in January or February? What lessons have you learned that you would pass on to your successors? I think I would, frame that question in terms of not necessarily substance. I wish I'd known there was going to be a COVID-19 virus, and, wish I'd known about ventilators particularly, but are there things in terms of process that you wish you'd known? Are there things in terms of people or relationships you wish you'd built ahead of time? What would have made you more effective if you had had a month to develop it coming into this? And I see you all thinking hard, so whoever has the first strike of inspiration can go first. Dean Solomon, you've stumped them.
I think we've created systems and different kind of groups and mini task force that are specialized in different areas to help provide feedback and guidance to the mayor during this. But I think it took us a little bit to get those set up because we were in such response mode. Mm-hmm. And so I think if I could tell myself to set those up earlier, I think that would have been helpful to have that community feedback loop just a little bit earlier, so that we could really hear a little bit more. I think when you're responding to a crisis like this, you can sometimes forget to jump in on that piece right away. So that's what I would say.
Makes me think about your capstone project, Maggie, which was about listening in the city of
Yes, Richmond. Very true.
Prepared you well. Mark? I need you to...
So I think the biggest thing that comes to mind for me is perhaps having a better handle on certain aspects of state government that I'm not directly involved in, but that wind up having an impact on issues that come across my desk. So I think, for example, the state procurement process is not something that I am directly involved in at all. I don't put out contracts for bid. I don't, it's not something that I do and probably never will do. But having a really, really good working knowledge of that system, I think could have saved a couple phone calls and would have enabled me to get answers out more quickly. I don't think it had any kind of broader impact on how things turned out necessarily, but it's just a general rule. I think that there's always more to learn about your job, even if you've been on it for a while, and having that information ready to pull or know exactly where to go to get it. I think that's because it's really, I guess the broader lesson is the surprise of how this happened, right? There hasn't been a situation like this in my grandfather's lifespan, let alone anybody else's. And so being prepared for the unexpected in some ways, I think, would be a good lesson to take forward.
I always tell students, I think students come in thinking policy is about knowing technical details about something. You know, it's about knowing the science of this or that. But it's about that, but it's also about the process, how things are purchased and how decisions are made. And it's about the people. You know, it's so much of your jobs is our relationship building. And this is the time when you lean on that and you know who to make the phone call to, and they pick up the call and they return it promptly. You have a relationship that gets you the information you need to help the, in your case, the state lawmakers make the decisions that they need. So it's a crucial part. And I think it's a kind of non-intuitive to the outsider. Lauren?
Yeah, so I think, and this goes a lot to the inequities we've been talking about, also the broadband access. So part of the work I do, in addition to making sure veterans have access to care, is a lot of work related to addressing social determinants of health. So that's looking at food insecurity, housing instability, access to transportation. That's what I'm pretty passionate about doing. And I wish that, so we do a lot of screening in clinics to determine if veterans have those needs. And then providing them with resource guides to make sure that they are able to connect with the appropriate resources in both the VA and the local community to have those needs met. But a lot of that shifted, obviously, with COVID-19 about whether or not those resources were still accessible. Did they still have funding to even provide those services? Were they open? A lot of the housing supports, for example, aren't able to be accessed right now because they're not able to have new people kind of move in and out of these housing communities. So that was one of the resources that was taken away. And I guess going back to January or February, I wish there had been more forethought put into determining how we could continue to screen veterans for those needs while not in clinical settings. Instead, I've spent a lot of time over the past several weeks trying to figure out how we can continue to screen veterans either via their telehealth appointment or to allow them to be screened online and still get the information they need to connect with those resources. So not only do we need to figure out a better way to systematically screen veterans for those needs, but then also we spent a lot of time, about 2 weeks, updating all the resource guides to make sure they only contain resources that are available right now, as opposed to having veterans call resources that can't even support them at this moment. So I wish I'd had more time to think through all of that and come up with a better solution.
Fair enough. So we're wrapping up with our time here. I see a lot of great questions. I'm just going to choose part of Allie's question here. And she's really asking at the heart of it, how have your organizations learned in new ways? And I think we all have sort of standard operating procedures about how we get feedback. As I mentioned earlier, Maggie's capstone project, which here at Batten for the master's program, we call the Applied Policy Project, the APP. She was looking at how Richmond, one of their offices, did listening sessions. And it seems to me that so much of the problems that we're facing, the three of you don't have the answers, right? You need to be able to learn the answers, and probably from people you don't have relationships with. You know, Allie's asking questions about local grassroots organizations, people that maybe normally wouldn't be a part of the decision-making process through your very formal, you're all powerful people, even in your young phases of your careers. And you're working in important shops. How have you guys been learning, either you personally or your organizations more broadly, in ways that you haven't learned before that weren't those standard operating procedures? And maybe I'll start with Maggie, since I think you referenced some of that earlier in the very active community you have in Richmond that's helping you learn.
Yeah, so we've had to pull together various groups, you know, especially from our small businesses in different ways than we have before, just so that we can have that feedback loop about how different policies, either from the state or the local level, are impacting them. So we've pulled restaurant groups together. We've pulled together a group of local activists to talk about the inequities that we're seeing in Richmond as well, those that have existed, and then those that have had a particular light shed because of the pandemic. So we've pulled together that group to think through with the mayor. Okay, how do we move forward? How do we respond to immediate needs right now? Whether that's supporting, you know, the mayor's eviction diversion program, because we're seeing a lot of eviction notices being issued after the pandemic restrictions are removed in Virginia. And so we've pulled together those groups, and we've kind of split them up in terms of some issue areas. So, I've been engaged with some of our, transportation advocates, for example, on how we think about using an open streets program in the city of Richmond, and how we use our public spaces differently going forward. I've worked with some of our environmental advocates on how we think about open green space in the city and how they've been historic inequities there. So I think we've really pulled together a strong team within the community, and we rely really heavily on those folks because they're on the ground, they're hearing stuff from people in need on a daily basis. And so I think that's been really powerful, and I think we need to continue to do that. We certainly have not had conversations with everyone, but we're looking for different ways that we can engage the community virtually. The mayor normally does 9 town halls starting in May. So we're having to think through how we can still have that community engagement on a broad level as well.
That's really beautiful. Let's go up to levels of government. Mark?
So I think in terms of one thing that I've had to get more experience with is figuring out how to access estimates and information on federal funding. There actually are a number of good resources out there that sort of help state budget offices, both on the executive side and the legislative side, with federal grant money and help them figure out how much is actually going to be available. And those are resources I had not used before. It's been important to have an idea on that because so much of the aid dollars in terms of what the General Assembly has dealt with right now has all been federal money, and trying to figure out, well, how much is it likely to be? What are the parameters going to be on it? The restrictions, what can and can't you do? Getting that information as quickly as possible so that the decision-making process could start was really critical in the past few months. So that's one area that I've had to brush up on quickly.
Great. Lauren?
Yeah, so I think I've seen a lot more flexibility in the government in terms of ridding ourselves of some of the bureaucracy that existed before. We've been able to actually achieve things much more rapidly than I would have expected through significantly increased collaboration. So I'll say, as you can imagine with an organization that's as large as the VA, which has, over 300,000 employees, things tend to get pretty siloed. There's a lot of working in silos and then realizing that same work has been done by someone else. So I think what the VA has done a great job of during the COVID-19 pandemic is A, responding much more rapidly than we had to past challenges, and B, being really open to work across kind of the aisles that exist within the VA. So that means working with both operations partners. So I'm considered, in clinical operations, and being able to work with people, really high up in VA to get things done, and also working with researchers in the VA. So typically operations partners and researchers don't necessarily work closely together, but we actually, and a quick example of this was working together to build a social risk factor screening to actually put into our electronic medical record system. And that took collaboration from undersecretaries in VA, researchers in VA, clinical operations teams, as well as information technology. So IT has even been super helpful during this entire instance. And I think that collaboration speaks volumes to what we could actually accomplish if we can continue to work that way in the post-COVID pandemic time and beyond.
That's a great hopeful note to end on. So I want to say a big thank you to all 3 of our panelists, Mark, Lauren, and Maggie. You're all wonderful Batten alums. We're incredibly proud to have you as members of our alumni network. I know 2 of you have supervised APPs that I have been also supervising in the last semester. And so thank you for your continued service to our school. And thank you for your service to our country, but all the different levels. Work you guys do is important, and we're grateful for your sacrifices. I also want to say thank you to everybody who's been on the call. If you're a panelist and you haven't clicked on the participant list, I feel certain you'll know some of the names. I see students from across the years on the call. I can tell it's as not because they want to see me, but because they want to see you guys. You guys are awesome. And we have current students as well. Wish we could give you all a shout. We're glad you're here. And thanks for those that aren't students for joining us. We'll continue to put on Batten Expert chats across the rest of the summer. Please tune in to the Batten social media to be able to hear that. And we thank you guys for attending. Thanks.